Hi everyone, I'm Richard from 3Shape. Welcome to Facebook Live. I'm going to show you a couple of tips and tricks with TRIOS. First things first, just so that you know, there is sometimes a little bit of confusion out there about how to wipe this down. Only use isopropyl wipes with nothing else in there. So denatured isopropyl, 70% per volume. That's to wipe the body down and to wipe the tip down before you would sterilise it. If there's a large amount of bioburden on here, what I think you need to invest in is a really soft toothbrush. This is really soft, and you may need to just scrub that mirror up just a little bit. You would rinse it very well. Only use mild soapy water, so just dishwashing liquid is enough. Just a small drop. Don't use anything that's clinical. So anything with any oxidizing agents may deteriorate this plastic prematurely, so avoid them at all costs. Okay, so once you've cleaned it, you need to rinse it very well, and you need to dry it well too. I don't want any residual moisture on the mirror tip because that can leave marks on the mirror. Then you bag it just like normal. If it's a TRIOS 4 tip and you're sterilising at 134 degrees, minimum of 3-minute hold time. If it's a TRIOS 3, which is a little bit different, it hasn't got the black marking on there, 134 degrees for 4 minutes at holding time at a minimum. If you want a lower temperature, 121 degrees, then you would hold the TRIOS 4 tip at temperature for 15 minutes. If it's a TRIOS 3 tip, you would hold it at 121, the lower cycle again, but for a longer period of time of 45 minutes. The reason we have a little variation with the difference between the T4 tip, this one, or the TRIOS 3 tip, is the TRIOS 4 tip has some electronics in here. So we call this a smart tip. If you're not familiar with it, it actually tells you how many times you've used it. So it's an improvement on the TRIOS 3 tip in terms of just keeping a track of what you've been doing. Okay, so a couple of little tricks I want to show you. Now, I do a lot of training and I show people how to use the scanner, and we talk about scan strategies. I'm not going to get too much into the scan strategy detail at the moment, but people tend to question, how do I reach the distals of the 7s? And of course, we can't leverage up the patient's upper jaw like a crowbar. That's not acceptable. But what I suggest is to actually attack the situation from the opposite side of the arch, put the scanner into position, and then we twist it. Okay, so if I was to close the mouth, it's a little bit, I'm just going to rotate this way. So it would enter the mouth from the opposite side of the arch and just twist the scanner, and you'll see the distals here. Instead of trying to do this, that's relatively impossible. Just a little trick in terms of the approach to get some of those difficult areas. Also, just give yourself a chance when you're in those areas. You can slow down just to give yourself a moment to get those different angles and just try some different approaches. It's not easy all the time, I understand that, but just a little cue. Okay, the next one. So if you're not aware, we currently have the opportunity to take a bite or a static bite. Now, you still have to position the jaw into that correct position. Unfortunately, it's not a magic scanner. It's not going to find the bite for you. And the reason for that is quite simple, is if you were to, or you wanted to create a sleep appliance, for example, you may need to open the bite and protrude the jaw forward. You would actually scan in that position. But I want to talk about the patient-specific motion. Patient-specific motion is actually being able to capture the movements of a patient's jaw. When you initially use that part of the software, you would be used to capturing a scan by placing the scanner to the most distal part of the mouth and moving the scanner forward to capture a static bite. But with the specific bite or patient-specific motion, the patient does the moving, okay? So you need to keep this scanner in one position or still and let the patient move into protrusive and latero-protrusive. I know it's quite simple, but I've seen some people just get stuck and they say, I can't capture that bite, that motion bite. So that's really important to keep this still. Okay, so now I want to move into a little bit of the software. So you can't look at me anymore, you're going to have to look at a screen, unfortunately. And I'm going to go through a couple of little features that I want you to be aware of. Now, I know people don't like to trim their scans. It's a little bit like washing your dishes. No one really wants to do it. But it is a big improvement in terms of the file size. And it's also a lot neater to send to a laboratory. And I'm going to show you a trick. This is a fun one because it's actually what we call the laser. Okay, so I'm just going to go back to the step. So traditionally we would use the brush and we would go all the way around the borders. This one, because the laser cuts through everything, I line up the model like this. I press laser, I'm going to be choosing the 1mm cutting tool, and then I just draw a line. I usually follow the mucogingival line as a guide, and then I press clear patches, and magic. Oh, and I've trimmed all the way around in just 1 or 2 seconds. So really there's no excuse not to trim the borders. It's really actually quite important. I will show another slide in a moment about the bite, and if you have overextensions here, so say you had captured a cheek, very much like a standard plaster model, it will actually stop you from bringing the bite together. So just get into the practice of trimming. The other thing is when you post-process this data, if you've trimmed the model, you've actually decreased it in size, the post-processing step is actually quicker. So you may think you're saving time here, but we've already thought about that. If you trim, you'll save time at the end before you send the case. So think of that. Okay, so we've covered the laser. I want to talk about the lock tool. The lock tool is up here on the left-hand side, if you can see my arrow, and it is the antithesis in a way to trimming. What we're doing with the lock tool is we're telling the software that there's an area here that I want to preserve. Because when we're using the scanner, we're capturing 2,000 to 3,000 images a second, and some of those images stack on top of each other, just by the nature of the way we're scanning. Now, if you'd retracted the gingiva around your margin, and that fell back onto the margin if you were scanning somewhere else, if you scanned it again, you'll capture the new image where the gingiva is. So if you use the lock tool, it stops that. And why is that handy? If you have multiple units with retraction, you could actually focus on one single tooth at a time, retract the gingiva, use the lock tool to lock the area, and then move on to the next tooth. And this one that you've previously scanned, if it bleeds or the gingiva falls back on, because you've locked it, you've preserved the surface. So it'll give you an opportunity to work on multiple units and capture that all-important margin, which is really critical for good prosthodontics. Okay, just another little trick. I'll show you a little trick. You can see here it's in grey. I will actually turn the colour off. If you don't know that we can make it a monochromatic image, you'll see a teal colour and it's really, really evident. Okay, so I'll just click this. And now you can see here, this sort of teal colour. That's protected, that's protecting that vital three-dimensional image that we've captured, which is the margin, which is integral and very, very important, okay? Another good thing about turning to mono is if you're doing an initial scan and you're looking at your arch, if you were to see any lines on the incisal edge, like a black line, for example, that's an indication that you may have created a discrepancy or an inaccuracy here. So I think it's really a good practice to, whenever you do a scan, turn the colour off, look at it in the monochromatic colour scheme, and analyse the scan and have a look at any aberrations before you proceed and send that case to a laboratory. It will save you a lot of time in the long run and remakes and so forth. I think the worst thing to happen is to send a case and it's distorted, and then you're going to have to redo it again. So what you do, if you weren't happy with your scan, press this big square button, clear scan, start again, maybe you've lost a minute or two, okay? Just a little bit of advice. Okay, so we've covered the trim tool, we've covered the lock tool. I'm going to bring an image up now. I'm going to show you where in the software, because there is a choice. We can adjust the bite. And a lot of people don't understand what the software is actually doing, okay? I will. So if I go back to this step, we'll see, oh, it's actually in the bite. So just bear with me while I just bring that image up. Oop, I've gone too far. That's always the way when you're doing live streaming, is you want to show something and you've got to wait for the software to pop up. So here, okay, so some of you may not have really looked at this, or you just went, oh, don't know what that means, and you've ignored it. My preference is, my advice is to keep it off, turned off, because what it does is it moves the impressions apart to the first contacts. So what can happen is, when we take an actual scan, or even a polyvinyl siloxane impression, a traditional impression, the teeth aren't loaded, so they're not in function. So it's a little bit like bringing a car off the road where the wheels hang down. When we load teeth, or when they're in compression or they're chewing, they move into their periodontal socket. So our scanner is accurate to 6.9 microns. Generally, a periodontal ligament will move or displace about 7 microns, so we can actually pick up the difference. When we take an actual bite in a digital format, or even in an old way, you generally ask the patient to bite down, so they're loading their teeth. So what happens digitally, we get what we call a crossover, or intersection, where the two impressions cross over. I'll show you an image just so that you know exactly what I mean, because a photo is sometimes better in terms of, let me just, oops. This is what I mean. So here, I'm looking at the impression from the inside, and the lower antagonist is actually pushing through, because it's the model's been scanned out of compression, but then with the bite, it's all come together. So what that means is, if you adjust for bite, you don't get this crossover, and this area here, especially this one, it looks a little bit like a class 2, division 2, where the lower anteriors are actually really biting hard into the palate. Now, a digital impression like a stone model is a hard surface generally. The software doesn't know it's soft tissue, so if you press adjust bite, it's going to make sure that this doesn't cross over, okay? Just go back. You can see here, very heavy bite here. So I would keep this off, because it's representative of the patient's actual bite. When they're in a clenched position, those lower anterior teeth displace the gingival tissue on the palate, okay? So if you don't want your crowns high and you don't want to grind your crowns in, keep that off, okay? It's really interesting. Even with a stone model, I was a technician for a long time, we would actually trim away all that soft tissue to get the actual bite. So good luck, okay? Don't use adjust bite, that's my final tip. Is there anything else that I need to cover? Really, it's just a very quick introduction to some of the tips and tricks that we show in our masterclass, which will be coming up next year, where we get into the nitty-gritty of some of the settings within the 3Shape software. Not only in terms of the bite, we will talk about shade and color and a whole lot of other different topics and things that are related to dentistry and how they translate from a digital world. So thank you very much for your time tonight. I know it's really quick, but hopefully you've learnt something. I'm sure you have. Maybe it's posed a lot more questions, but please reach out and we'll answer them for you. So again, thank you very much.